Leicester is a city that thrives on its diversity and multicultural spirit. Over the past 20 years, it has transformed into one of the UK's most vibrant and globally connected cities, with a population made up of communities from South Asia, Africa, the Caribbean, and Eastern Europe, among others. This melting pot of cultures is reflected in the city's festivals, food, and everyday life. However, despite this progress, challenges remain, particularly in healthcare. Ethnic communities in Leicester still face barriers to accessing care, with underserved populations experiencing health inequalities and poorer outcomes due to factors like language, poverty and cultural differences. As Leicester continues to grow and change, addressing these gaps in healthcare is crucial to ensuring everyone can benefit from the city's successes and the diversity we all celebrate.
Looking after our health is important to all of us, whether that is physical or mental health. Living a healthier life allows us to lead a happier life, which allows us to flourish. It's also important to understand why certain communities are affected by health conditions. So here's Indu, who's taken part in health research studies. What's your experience been like in taking part in the research studies?
My experience was great in taking part in the research studies. By doing that, I learned so much about my health and how to improve it.
So do you think it's important for people to take part in health research studies?
I think it's very important because that way you can learn about your health conditions and symptoms and better treatments.
Well, there are a number of ways you can potentially support research, and at any one time there are hundreds of research studies which are going on. Firstly, you can access research via your National Health Service. Your GP practice or your hospital team may invite you to take part in research. This may be related to the medical problems that you have or your family has. There are also a wide range of studies where you can participate where you don't necessarily have to have the condition. Patient organisations such as the British Heart Foundation, Diabetes UK and cancer charities may also have details of research studies you can participate in.
There are many types of research. Some require you to do online surveys, some are in person, some are blood sample related. So some of them look into diabetes, depression, stroke, delirium, foot care. The aim is basically to improve health outcomes. If we get involved in research, the professionals get to know what's working and what's not working, and this will help our future generations as well.
Let's be real about healthcare first. One size doesn't fit all. Different communities have different healthcare needs, and if we don't take part of the research, we will be left behind of the solutions. Most medicine and treatment are always tests people who do not look like us. This means we won't know if it will work same way on us. For example, pulse oximeter was found to give inaccurate reading for people of darker skin tone like me. It was only after further inclusive research was conducted this was corrected. It's about making sure that the health sector sees us, serves us effectively.
Break down barriers together and ensure a future where every community is heard and cared for.
Zara, have you heard about the P part of Research Registry?
Yes, it's easy to sign up. You register online, you share which health areas interest you, and then the researchers come back to you with an area or a project that's available to them.
Many people don't realise that it's really important that everyone gets involved so that we can ensure that research is effective, it meets needs, and it addresses inequality. Signing up is a simple way of making a big difference.
Let's spread the word and get registered.
Because better research means better healthcare for everyone.
To find out more and join the National Register for Research, please visit bepartofresearch.co.uk. Better research means better healthcare for everyone.